You've tried face washes, you've tried the creams. So why does your acne keep coming back? If you're frustrated because your acne just won't clear up, you're not alone. Millions of people deal with stubborn, persistent acne, and it's not because you're doing something wrong. There are real medical reasons why acne sticks around, and today I'm going to walk you through the most common ones. Hi, I'm Dr. Morgana Colombo. I'm a board-certified dermatologist in Northern Virginia and founder of Vida Derma, a science-backed skincare line to help women as they age. So let's start with the basics. Acne is not just a surface level skin problem. It's a chronic inflammatory condition that starts deep inside your pores. Your skin has tiny structures called pilosebaceous units, basically a hair follicle attached to an oil gland. When those oil glands produce too much sebum, when dead skin cells clog the pore, and when bacteria called Cutibacterium acnes build up inside, you get inflammation. That inflammation is what causes the redness, the swelling, and the painful bump. Now, here's the key point. Acne involve multiple processes all happening at the same time. Excess oil, clogged pores, bacteria, inflammation. If your treatment only targets one of those, the others keep driving the breakout. So that's one of the biggest reasons acne doesn't go away. Now let's talk about the specific reasons your acne might be sticking around. Number one, your acne treatment probably needs more time. This is probably the most common issue I see. Most acne treatments take 6 to 12 weeks before you see real improvement, and maximal results often take 3 to 6 months. A lot of people try a product for 2 to 3 weeks, don't see a difference, and stop using it. That's completely understandable, but it means the treatment never really had a chance to work. Patience is one of the hardest parts of treating acne, but it's so critical, guys. Number two, you may not be using the right combination. Acne has multiple causes, so effective treatment usually requires a combination approach. For example, a retinoid helps unclog pores while benzoyl peroxide kills bacteria. Using just one product often is not enough. Dermatologists frequently combine topical retinoids with benzoyl peroxide or antibiotics because together they address more of what's driving the breakouts, all the multiple causes. Number three, when it comes to stubborn acne, your hormones may be playing a bigger role than you realize, especially in adult women. Hormones, especially androgens like testosterone, directly stimulate your oil glands to produce more sebum. This is why acne often flares during puberty and around menstrual cycles or during times of hormonal change. For some women, conditions like polycystic ovary syndrome or PCOS can cause persistent acne along with other signs like irregular periods, excess hair growth, weight gain. If your acne is concentrated along the jawline and lower face, or if it's not responding to standard treatments, a hormonal component is worth exploring with your doctor. Number four, your diet might be contributing to your acne. Now, this is an area where science is still evolving, but there is growing evidence that certain dietary patterns can influence acne. Foods with a high glycemic index, things like white bread, sugary snacks, sweetened drinks, those can all cause spikes in insulin and a growth factor called IGF-1. These signals can increase oil production and inflammation and lead to acne. There's also research suggesting a link between dairy intake, particularly skim milk, and acne. This doesn't mean you need to overhaul your entire diet, but if your acne is persistent, paying attention to these patterns may be worth discussing with your healthcare provider. Number five, stress is a real trigger for acne. I know it sounds like a cliche, but there's actual science behind it. When you're stressed, your body activates what's called the hypothalamic pituitary adrenal axis, essentially your stress hormone system. This releases cortisol and other neuropeptides that can increase oil production and ramp up inflammation in the skin. Studies have shown that acne severity increases during high stress periods like exam weeks, right before a wedding, divorce. Managing stress won't cure acne on its own, but it can be an important piece of the puzzle. And number 6, sometimes what looks like acne isn't actually acne. Conditions like fungal folliculitis, rosacea, or even reactions to certain medications can mimic acne, but require completely different treatment regimen. So if you've been treating your skin for months without any improvement, it's worth having a dermatologist take a closer look to make sure the diagnosis is correct. What you should take away from all of this: persistent acne is common, not your fault. It's a complex condition with multiple drivers: oil production, inflammation, bacteria, hormones, and even lifestyle. The good news is that effective treatments exist for nearly every type of acne and severity of acne. But finding the right approach often takes time, the right combination of treatments, and sometimes a deeper look at what's going on beneath the surface. If your acne isn't improving despite your best efforts, talk to a dermatologist. They can evaluate whether your current approach needs adjusting, whether hormonal factors should be investigated, or whether a stronger treatment like isotretinoin might be appropriate. So if you found this helpful, consider subscribing for more evidence-based health content, and drop a comment below. I'd love to hear what questions you have about acne or any other dermatology issues. Thanks for watching, and I'm going to see you in the next video.